If you care even a little about your penis, and let's be honest, most men do, then this video is something you shouldn't skip. I'm Dr. Noelia Carvión, urologist and pelvic surgeon, and today we're going to walk through the things you should never, ever do to your penis if you want it to stay healthy, responsive, and functioning the way you expect it to. I've spent years treating men of all ages, and trust me, your penis will tell you a lot about your body if you're willing to pay attention. So stay with me until the end, because the last point tends to surprise almost everyone who hears it. Before we dive in, I want to ask for a small favor. If you've been watching the content here on Senior Health Booster, or you've stumbled across one of our videos in the past and found it helpful, make sure you're subscribed. And if you already are, double-check that your notifications are on. I see thousands of men watching these videos, but only a fraction actually subscribed, and that means many of you miss out on information that could genuinely change your health. Sharing this channel with a friend who might need it also makes a bigger difference than you think, especially because so many men suffer in silence when it comes to their sexual health. Your support helps us educate people who may never feel comfortable asking these questions publicly. Now, the first thing you should never do is also the one that seems the simplest. Don't ignore your penis. You'd be surprised how many men assume that changes in erections, sensation, or desire are just normal aging or something they should brush off. But erections are one of the most reliable early indicators of your overall health. When a man suddenly starts having trouble maintaining an erection, it's rarely just about the penis. It's about blood flow. It's about hormone balance. It's about nerve function. It's about stress, sleep, mental health, and sometimes even hidden heart disease. In fact, men who develop erectile issues are statistically more likely to experience a cardiac event within the following several years. I like to say that the penis is one of the body's earliest warning systems. When it's working well, it tells you everything inside is flowing the way it should. When it's not, the body is whispering to you, and if you ignore it, that whisper eventually becomes a shout. The second thing you should never do is experiment with DIY methods you find online or hear about from someone who isn't a trained medical professional. I know there's a lot of pressure surrounding size, performance, and confidence. I know how desperate men can feel when they worry something isn't working the way it used to. But the internet can be a dangerous place for advice, especially when it comes to something as delicate as the penis. There is no home remedy that will safely make you bigger, thicker, or harder in a way that lasts. There is no miracle oil, no strange household substance, no bizarre stretching ritual that is going to work the way the ads promise. I once treated a young man, let's call him Daniel, who had spent months trying to lengthen his penis by pulling and squeezing with intense pressure every night because a forum told him it would unlock hidden gains. Instead, he ended up causing microscopic injuries that eventually led to scar tissue, curvature, and difficulty getting erections. He wasn't the first, and he certainly won't be the last. Techniques like jelqing can create tiny tears that accumulate over time until the damage becomes permanent. And the problem is, once that damage sets in, there is no easy fix. So if you've been tempted to try something you saw online, stop. Your future self will thank you. Men also get into trouble with homemade constriction devices. I remember a patient, we'll call him Marcus, who slid a metal nut over his penis because he thought it would help maintain his erection, just for a minute. Hours later, he was in the emergency room, swollen, panicked, and unable to remove it. The fire department had to come in with specialized tools to cut it off. The pain, the swelling, the risk of losing blood flow, it simply isn't worth it. If you ever need a constriction ring, buy a medically approved one. It's designed to be removed safely, even if something goes wrong. The third thing you should never do is neglect basic hygiene, especially if you have a foreskin. Every day, I see men who come in with irritation, redness, and infections because they weren't cleaning under the foreskin or weren't drying it properly. Conditions like balanitis are not only uncomfortable, they can make sexual activity painful and even affect your ability to retract the foreskin over time. But on the other side of the spectrum, aggressive cleaning can be just as harmful. Your penis doesn't need harsh soaps or strong fragrances. It needs gentle cleaning with mild soap and water, nothing more. Treating the skin too roughly can lead to irritation, tiny cuts, and infections that could have easily been avoided. If you ever notice that your foreskin doesn't pull back fully, that's not something to ignore either. Sometimes it's just tightness that can be treated with a cream or gentle stretching under medical supervision. Other times, it requires a more involved solution. But pretending it's not happening won't make it go away. You should always be able to retract and clean comfortably, and if you can't, talk to your doctor sooner rather than later. And the fourth thing, perhaps the most important emotionally, is never ignore pain, swelling, sudden changes, or anything that feels off. Your penis is not supposed to hurt. It's not supposed to bleed. It's not supposed to bend sharply out of nowhere. It's not supposed to change color, sensation, or shape suddenly. When something shifts, your body is telling you that something deeper needs attention. Do not ignore it. When something feels different, when there's pain or discomfort or a sensation you've never noticed before, that is your body waving a flag you can't afford to look away from. Sometimes those changes point to something as simple as a urinary tract infection, something treatable and relatively harmless if addressed early. But sometimes it signals something more serious, like a sexually transmitted infection. And when you see blood in the urine, you should never assume it's just because you worked out too hard or didn't drink enough water. Blood can indicate a kidney stone or a bladder stone, but in rare cases it can point toward cancer. And I know that word alone makes people freeze. It can be cancer in the bladder. It can be cancer on the penis itself, especially if you notice an ulcer or an area that looks raw, open, or refuses to heal. This is the moment where many men go silent. Shame creeps in, fear takes hold, and instead of reaching out for help, they convince themselves it will go away. But ignoring it only gives the problem more time to grow. I understand what it feels like to sit in a doctor's office, anxious about dropping your pants and being vulnerable. I understand the fear of being judged, especially if you had unprotected sex or made a decision you don't feel proud of. But your health is not something to gamble with. A good doctor, any doctor worth seeing, wants you healthy, safe, and informed. And if you ever feel judged or dismissed, find someone else. Your comfort matters, and so does your life. The saddest moments in my entire career have come from men who ignored ulcers that eventually revealed themselves as penile cancer. It's rare, so rare that I've only encountered a handful of cases, but when it happens, it is devastating. It progresses quickly, and the treatment becomes far more invasive the longer you wait. And every single time, these men delayed seeing a doctor because they were terrified of what they might hear. But early treatment always means a better outcome. Taking action early means preserving more, losing less, and avoiding the trauma of severe complications that could have been prevented. That brings me to something equally important, staying in control and staying safe, not just in the medical sense, but in your sexual life as well. There is nothing more freeing, more intimate, more exciting than knowing you're having sex without fear. When you're not worried about infections or unplanned pregnancy, your mind relaxes. You become more open, more confident, more present with your partner. Safe sex is not just responsible, it's liberating. And condoms come in more types and textures than most people ever explore. You can choose thin ones, ribbed ones, snug ones, wider ones. You can even make it a shared experience with your partner, figuring out what feels best for both of you. But safety isn't just about protection. It's about staying in control of your body so that passion doesn't turn into injury. Penile fractures happen far more often than you'd imagine, usually during vigorous sex when the penis slips out, hits the pubic bone, and bends sharply. The sound, the pop, is unforgettable. The pain is immediate, and the swelling that follows is unmistakable. This is not an injury you walk off. It requires emergency surgery because the tunica albuginea, the tough layer surrounding the erectile tissue, tears. If that tear isn't repaired, the scar tissue that forms can curve the penis, distort it, and make erections difficult or even painful. Half of the men who delay treatment end up with erectile dysfunction. That's why control matters. Hold your partner's hips. Guide the angle. Communicate. Passion should never cost you your ability to function later. Lubrication also plays a huge role in preventing these situations. Lube isn't just extra, it's protection. It makes movement smoother, reduces friction, and lowers the chances of bending or slipping. And needing it doesn't mean anything is wrong with your partner. Women naturally produce less lubrication during certain phases of life, especially in perimenopause or menopause, and even younger women can experience dryness due to stress, medications, or simple biology. It's normal. It's human. And using lube makes the experience better for everyone involved. Another thing to keep in mind is temperature. Your testicles hang outside your body for a reason. They need a precise climate to produce healthy sperm and support proper hormone function. When you expose them to excessive wet heat, like prolonged hot tubs or long steamy sessions in saunas, you can actually reduce your sperm count and potentially affect testosterone levels. You don't have to avoid these things forever, but moderation matters. The same goes for laptops on your lap or phones kept in your front pocket. These everyday devices give off heat that slowly warms your groin in ways you don't notice until it becomes a problem. Create space between the device and your body. Keep your phone in your back pocket. Small changes make big differences over time. And finally, be gentle with yourself, literally. Many men underestimate how strong their own hands are when they masturbate. That death grip, the overly aggressive pressure some develop over years of habit, can condition your body to respond only to sensations that no partner could realistically replicate. Over time, this makes arousal with another person more difficult, not because anything is wrong with you, but because your body has been trained to expect a completely different kind of stimulation. It's not about shame. It's about awareness. Being gentle, using lubrication, and varying stimulation helps reset that sensitivity so your sexual responses stay flexible and healthy. Your penis is not just an organ. It's a signal, a barometer, a communicator of your inner health. Paying attention to it, protecting it, and treating it with respect will always lead to better function, better confidence, and better long-term well-being. So when I say be nice to it, I mean something far deeper than the quick warning most people expect. I mean honoring the connection between your body and your mind, choosing to treat pleasure as something human, healthy, and deserving of time and gentleness. Masturbate in ways that resemble the sensations you would share with a partner. Use lubrication. Let the moment unfold. Allow your body to warm up gradually instead of rushing through it in secret like it's something shameful that needs to be hidden or finished before someone walks in. Pleasure is not an emergency. It is part of how your nervous system regulates itself, part of how you keep the signals between your brain and your body healthy and alive. And the less shame you attach to it, the more control and awareness you gain over your own arousal, your own patterns, your own needs. That same kindness extends to your overall health because nothing destroys erections faster than smoking. Dr. Noelia Carvión says this constantly, and she's right. Smoking narrows arteries, damages blood vessels, cuts off oxygen, and over time it suffocates the very system responsible for healthy erections. I have never once met a long-term smoker who didn't pay a price in the bedroom. And beyond the sexual side, smoking is one of the strongest contributors to bladder cancer, something I see far too often. The treatments are invasive, the monitoring involves cameras and scopes, and if surgery becomes necessary, the consequences can alter your life permanently. These are not small problems. They change everything about how you function day to day. Your lifestyle shapes your sexual health in ways most men underestimate. It isn't flashy. It isn't a quick fix. It won't give you results overnight, but it is the foundation on which everything else stands. Eat in a way that supports your heart, your blood flow, your energy. Avoid the substances you know are hurting you. Move your body because circulation is the lifeline of every erection you will ever have. Aerobic exercise keeps your blood flowing freely, and resistance training supports your testosterone levels. Both matter. Both contribute to the way you feel and perform, not just in sex, but in your entire life. If you don't know where to begin, begin small. Begin embarrassingly small. Begin with a step so simple you cannot argue against it. 1 minute of movement. 1 walk around the block. 1 healthier choice. Those moments stack. They build. They reinforce your identity. And as time goes on, the momentum carries you further. That's the piece most men never give themselves long enough to experience, the momentum. Dr. Noelia Carvión once recommended atomic habits to a patient named Daniel Rojas, who felt utterly overwhelmed. He started with 10 push-ups a day. Just 10. 3 months later, he had changed his entire routine, not because he forced himself, but because the new identity slowly became natural to him. That's how change works. Quietly, repetitively, through softness, not punishment. And then there's stress, the silent saboteur most men pretend they can outmuscle. A little stress sharpens you, gives you focus, keeps you alert. But chronic stress? That will hollow you out. It will drain your sex drive, interrupt your erections, tension your body to the point that pleasure becomes secondary to survival. If you live constantly clenched, constantly powering through, your nervous system doesn't have the bandwidth to support normal arousal. And if you know deep down that stress controls more of your life than you want to admit, then something needs to shift, not because you're weak, but because your biology is not built to live like that forever. And still, even with all these pressures, I see men being brutally hard on themselves, as if their penis is a performance report instead of a living, responsive part of their body. They catastrophize after 1 bad night. They panic after 1 moment where things don't go as expected. But 1 difficult experience does not define you. What defines you is how you respond to it. Because the truth is, every man on earth goes through fluctuations, times where stress, exhaustion, fear, or simple physiology get in the way. The real danger is the cycle that follows, the fear that it will happen again, the self-judgment, the overthinking, the hyper-awareness of every sensation. That spiral is what actually makes it harder to get an erection the next time and the next until it becomes a self-fulfilling loop. Being kind to yourself interrupts that cycle. Talking to your partner interrupts that cycle. Giving yourself space to breathe interrupts that cycle. Men rarely talk about this. They rarely admit how anxious they are about their performance. But silence only magnifies fear. Openness dissolves it. And then there is the old saying, use it or lose it. There is truth in that, though it's often misunderstood. When you stop having erections altogether, whether because of stress, shame, or avoidance, your nighttime erections can fade as well. Those spontaneous nighttime erections are how your body oxygenates the tissue, keeps it healthy, flexible, alive. When they disappear, the tissue can stiffen, scar, or shrink. Men notice it in the mirror before they admit it out loud, a slight shortening, a change in elasticity, a different firmness. That's when the consequences become real. And if low sex drive enters the picture, whether from hormones, stress, conflict, or emotional distance. The body learns quickly. It adapts to the lack of stimulation. Drive decreases further, sometimes quietly, almost without you noticing. And while that may not bother everyone, it matters deeply when you're in a relationship where intimacy is part of how you connect, heal, and feel valued. There is immense benefit in maintaining that connection, in choosing closeness even when life gets heavy, in remembering that sexual intimacy is not about performance, it's about partnership. No matter your age, no matter your schedule, no matter what life has thrown at you, intimacy remains one of the strongest predictors of health, happiness, and emotional resilience. And sometimes, making the effort, even a small effort, is what pulls you back into your own life. Take care of yourself, not because you should, but because you deserve to.